People for acid reflux and heartburn, we continuously take medicines and constantly look for solutions to stop it. There are natural remedies, there are treatments, but is there a permanent solution that can stop this issue from people facing it constantly in life?
Okay, so since nearly 1 in 4 people or 1 in 3 people have a disease of heartburn, not everything is so severe that it needs a radical treatment. So out of these, nearly 40% of them would benefit from a permanent solution. But the remaining 60% can manage with lifestyle modification and simple medicines. So the first thing is lifestyle modification, which is a few tablets, which is what we would advise most patients. Not every patient with heartburn or esophageal disorder will need a straightaway permanent treatment. So we can start them off by lifestyle modification, by asking them to lose weight, cut down on aggravating substances such as tea, coffee, alcohol, carbonated drinks like Pepsi, Coke, etc. or cut down on tobacco, pan masala chewing, especially patients who are at risk. So these aggravating substances, many of the patients themselves will know what is making it worse for them. They have to cut down on that. That's the first thing. The second thing is other modifiable risk factors where they can lose weight. Obesity is a well-known risk factor for heartburn, and if they lose weight, they're found to reduce their symptoms drastically. So weight loss, and then the other things like they should stick to regular food timings. They should not eat at haphazard hours. They should not eat as and when they please. There should be a proper gap between the dinner time and bedtime. So the recommended gap for this is around 1.5 to 2 hours without lying down. And for patients who have an increased chance of acid reflux, especially this seems to happen at night for many patients, they should have the head end elevated by a pillow by at least 5 or 6 inches.
Okay, that sounds very interesting. An elevation could reduce the. Now, it's like we are increasingly finding like weight loss as a solution for many of the diseases.
It is.
Now, here specifically with this lifestyle change and weight loss itself is enough for our treatment.
So it's not enough as such, but it's a very good starting point. So many patients who just start having the disease, this might relieve them of their symptoms sooner or later.
How surgery can help come as a need in this treatment? Is it that serious that a surgery is needed for these kind of heartburn?
Okay, so the thing is that many of these patients with heartburn recognize it quite early because it's quite a troublesome disorder. But many of them may not recognize it because it would happen to them silently at night. So at night there's more and more acid coming up. So the next day they would notice a change in their voice. Some of them get up coughing and spluttering by choking, otherwise known as microaspirations, where a little bit of acid actually goes into the lung itself. So that's called nocturnal asthma. It's not life-threatening, but it is a very troublesome disorder. But the more serious complication of this heartburn disease is that heartburn over a long period of time can lead to changes in the cell type of the food pipe, and that can cause a condition known as Barrett's esophagus, which can further predispose to esophageal cancer. So adenocarcinoma is a specific type of esophageal cancer which is almost exclusively arising from a predisposing acid reflux disease. So that is one of the main worrisome complications. And then second, slightly less severe is nocturnal asthma, where patients keep inhaling so much acid while sleeping that it gives them continuous chest infections, and they get what is known as aspiration pneumonitis, where the acid and sometimes even a little bit of the food particles refluxes climbs upward, and it can go back into the lungs, and it can cause a bit of an infection of the lung, can cause a little bit of lung damage. And then the third thing, which is again a worrisome issue, is known as an esophageal stricture. So long-standing acid can cause this esophageal lining to get damaged and shrink. So like a wound which heals with a mechanism known as fibrosis, where it shrinks, the esophageal inner lining also will shrink and get stuck tight That's called as esophageal stricture, and these patients will struggle to even swallow after that. So for all these long-term complications, it's better to offer any patient with serious or severe gastroesophageal reflux disease a surgical option for permanent cure. So not all these patients of GERD would require surgery, but to find out which of these patients need a surgery and which of these can be managed with just medications and lifestyle modifications, you have to do a test known as the 24-hour pH study. So at LIMA, at our hospital, we do nearly 1 or 2 a day of this 24-hour pH study, by which we place a very, very thin, tiny tube connected to a chip through the nose to sit in the lower esophageal sphincter region, that is the lower end of the food pipe, and this chip has a pH monitoring mechanism by which it can study the amount of acid that climbs up and hits the esophagus. So based on this, we will, and the other end of the tube is connected to a PDA smartphone type device which can record the amount of acid coming up. So based on this, the patient requires this for 24 hours, and at the end of 24 hours, we will have a complete detailed report of how much acid is going up and hitting. And based on that, we can differentiate if it's mild, moderate or severe. So there's a specific amount of acid reflux percentage which would make it classify into mild, moderate or severe. So the mild cases can be managed with just some medications and lifestyle modifications, but moderate and severe would definitely benefit from a surgery in the long run, especially the severe ones who have acid reflux of over 20%.
Good. Thank you so much. And do you have any advice for people watching and suffering from heartburn?
So the most important thing is go to your doctor and tell them, please make sure you tell them clearly if your heartburn is not relieved on medications, or if you are dependent on medications, by where when the patient stop taking any kind of simple antacid medications like proton pump inhibitors, rabiprazole, omeprazole, razo, pan, etc. When they stop taking that, it gets worse. That is an alarm symptom. Same way, some of them, it's even worse if the disease continues in spite of taking these medicines. So those are the patients who will require further investigation by doing an endoscopy first and then a 24-hour pH study. So once this is confirmed, once a severe acid reflux has been established and confirmed, we can do a surgical treatment by which they will definitely benefit, known as a laparoscopic fundoplication. At our center, we've done nearly 2,000 to 3,000 fundoplications over the last 20 years or so, and it's a very simple, straightforward surgery for those who are experienced at it. So it's a half an hour to 1 hour procedure done through complete keyholes, and the patient is usually discharged the very next day itself.
So they can get back to their life?
They'll be back to normal within a day or two. They may need 2 or 3 days maximum rest. So by this surgery known as the fundoplication, what we do is this one-way road, as I told you, the valve or the door between the esophagus and the stomach, that part is usually loose in heartburn. So that should be made tighter by taking a bit of the stomach and wrapping it around the lower esophageal junction, by the gastroesophageal junction. This procedure is called a fundoplication, where the fundus of the stomach, the upper part of the stomach, is wrapped around the lower part of the esophagus. So by tightening it, you make sure that this acid doesn't climb up too much. And several hundreds of studies all over the world have shown that at the end of 10 years of follow-up of patients who have undergone surgery for GERD, nearly 90% to 95% have remained completely asymptomatic, with the remaining 5% to 10% requiring occasional antacid medications. So it's a definite permanent treatment. There are several other treatments which are quite expensive, which are, some of them may be even experimental, certain endoscopic treatments like a mucosectomy, certain other surgical treatments like a LINX system, whereby a series of titanium magnetic beads are placed around the lower esophagus. These are all experimental, These are all little difficult to do also, but it's not yet been established as per studies, unlike the fundoplication.
Thank you very much, Anirudh. That was very informative and helpful. And it's been consistently, we've been seeing in our first episode and second episode that being healthy, losing weight is one of the best way to stay healthy and to avoid a lot of issues. And like Dr. Anirudh said, heartburn, we should not just leave it just because it's a heartburn and it's a consistent small issue which can be on and off put to rest by the tablets. It's better we go and have a treatment. LIMA Keyhole Surgery Center at Kilpock. We offer this 24 hours pH balance study. So tell your parents, tell your grandparents to just come and do this small test to find out how serious is your condition, and accordingly the experts here who have done 2000 plus surgeries on this particular acid reflux issue and heartburn could help you in a longer run and to find a permanent solution. Thank you very much. Keep watching us. We will come back to you with a new topic next week. Thank you so much.